Hello. Hi. Thanks for waiting. Sorry about the delay.
Oh, no problem. No worries.
All right, real quick before we jump in, I'm going to go ahead and do all the legal jargon stuff that we have to do. Legal disclaimer for everyone watching. The information provided on this live is for educational purposes only and does not substitute for personal medical advice. We advise users to consult a local medical professional or healthcare provider if you're seeking medical advice, diagnosis, or treatment. All right, so now that that is gone, hello everybody. Thank you again for your patience and for waiting. My name is Linda. I am so happy to be here and to be hosting this segment of Derm Talk with you guys today. Thanks for joining us. For those of you who missed our first episode, it was a lot of fun. It was so informational. You definitely want to go check it out. We have it posted up on our Facebook page. Lots of good information in there. But if you're new to this and kind of what these are, these Derm Talk segments are basically going to be happening monthly. We have a guest dermatologist, just like today, from our dermatology advisory board, who's going to be joining us. And we're going to be talking about all things skincare and skin. Everything from, skin types, skin concerns, products, cosmetic procedures, all that kind of stuff. That's what these episodes are going to be talking about. So welcome, glad to have you guys here. We're going to be answering all of your pressing questions. So if you have any questions today during this live, please feel free to put them in the comments. We're going to get to as many of them as possible. So yeah, please let us know. We're also going to be debunking skincare myths. We have so many of those. I'm sure you've heard a ton of them, especially you in your practice, I'm sure. But we're going to be debunking all of those. And we're also just going to learn from the professionals. We have these amazing dermatologists who we're going to be speaking with every month. And they're the professionals. They're literally in the business of skin. So who better to learn from than them? So we are so excited about these. And welcome. We're so glad to have you here. There's going to be lots of useful information in these, obviously. So please share this with your friends. Friends don't let friends miss out on the best skincare advice. So please share. Yeah, so with all of that being said, welcome, Dr. Nkem. It's so good to have you here. Basically, she is a board certified dermatologist, Dr. Nkem Ugonabo.
You got it. Yay.
All right. I was so nervous I was going to botch that. All right, welcome. She practices at Union Derm in New York City and focuses mainly on cosmetic procedures and lasers. So welcome. It is so good to have you. Thank you for taking your time out to be with us today.
No problem. Thank you.
Yeah, of course. Can you tell us a little bit about you and about your practice and kind of what sparked your interest in dermatology?
Yeah, I'm actually born and raised in New York, but I've been all over the country for training and medical school, and recently trained in dermatology here at NYU. And I wanted to go into dermatology because it's such a diverse field. You can see everything, and I do see everything from kids to 99-year-olds, men, women, just old, young, benign. Cosmetics.
If you have skin, you can see a dermatologist.
Yeah, exactly. And everybody has skin. The skin is technically the largest organ in the body. So I just loved it. I also love that it was procedural, which for me, it's very gratifying to have people be able to walk into your office with a very specific problem or something that bothers them, and you can fix it and they walk out and they're happy. It's just so rewarding. So that's why I went into it. And then I decided to focus on cosmetics and lasers because, again, extra gratifying, and I like to play with devices. I really like the science and the technology behind it, as well as the art, which allows you to kind of almost sculpt, whether that's a face or a body, and again, to just sort of help people look like the best version of themselves. So that's what motivated me to go into dermatology, and then specifically in cosmetics.
Very nice. Awesome. So I know we mentioned a little bit that, obviously your focus is primarily on cosmetic procedures, things like that. What would you say the most common procedures are that people request when they come in to see you?
I would say the most common procedure is probably Botox, followed very closely by filler, because filler is I think becoming more common these days, particularly as a lot more celebrities are starting to, I think they've been doing it for a while, but a lot more are starting to open up about it.
Right. You mean they're being honest about it?
Exactly. And so, you know, the more honesty that we experience, I think it captures patients' attention. And so a lot of people are coming in for Botox and fillers, in addition to, you know, laser hair removal and other kind of devices.
Mm-hmm. Well, what can you explain for some people that might not know, what's the difference between Botox and a filler?
Yes. The simplest term that I can think of is, you know, Botox is for the lines that you get with expression. So, for example, because I don't have fresh Botox right now, so you can see those lines. And then filler is for lines or hollowness that you have at rest. So that's the simplest way to think about it. Botox actually is technically a brand name. It's a type of neurotoxin. The full word is botulinum toxin. And there are other kinds such as like Dysport, Jowls, Zeman, and all those work to freeze muscles that come with expression. So for a lot of people, it's the 11 lines. For others, it's, you know, forehead lines, all sorts of things. There are also medical reasons to do Botox. Some people don't know this, but if you have like teeth grinding and masseters, we can inject Botox there. If you have excessive sweating, we can inject Botox under the armpit. So there's different ways that you can be crafty with Botox. Filler, on the other hand, is for anywhere where you have hollowness or like a loss of volume. So, you know, sometimes as we age, our fat pads get smaller and we can put filler in to sort of fill in that volume. It's also for deep lines. So, for example, if you have deep lines in certain creases, filler can be helpful for that too.
Okay. So basically Botox, it's not just cosmetic. There's like other purposes that you can use it for.
Yes, and in fact, it's one of my favorite things to do with Botox is for the like medical reasons, because you can really change someone's life. You know, with the excessive sweating, for example, some people can't even do like public speaking or like go out to restaurants. They feel really self-conscious about it. And doing Botox in the armpit, it's a very quick procedure, and it can last, you know, for months, and people will come back regularly because they really like it.
Wow, that's cool. All right, I didn't know that. So with people who come in, I know, you know, people have their opinions about, you know, cosmetic procedures and, you know, their perceptions about that. What have some of the most common misconceptions been about cosmetic procedures that you've heard of in your practice or just in general?
Yeah, I think a misconception is, you know, I think people assume that it's all about vanity. And it's all about like plumping yourself up to look like, you know, some kind of caricature or like a celebrity. And I do think it's important to self. Oh, sorry, got paused for a second. You can still look like yourself with Botox and fillers. And sometimes it's just to sort of prevent or keep that look that you have and that you want going forward. So that's a big misconception. I think the other misconception, as we just talked about, is that sometimes it's not always aesthetic. It can be functional as well. And we can use a lot of, not just our injectables, but even some of the lasers and devices to help people fix things that they're having an issue with.
Okay, cool. And then also with cosmetic procedures, let's say like Botox or fillers or things like that, what type of, obviously you're not just going to give up your skincare just because you have Botox or you know, these fillers or cosmetic procedures. Are there certain ingredients or certain products that you think go really well together with them that you should use after, not necessarily right after procedures, but to kind of help maintain them or to prolong them?
Yeah, you know, not necessarily with that. So we like to recommend, you know, gentle cleansers and gentle emollients and things to help keep the skin, you know, from getting any sort of reaction or irritants. But with other things that we do, such as lasers, for example, if we were to do a laser resurfacing treatment, that's when we are very specific with what you should do for aftercare. And it's important because, you know, the skin is a little bit more exposed because we are putting lasers to the skin. So it's very important that you're not going to put anything harsh on it. So for example, we have a lot of patients who use retinoids every day. I love retinoids. That's another topic that we can cover later. But a retinoid is an example of something that if you came to me and we did a laser treatment, I might say to hold off on your retinoid for a couple days until the skin has a chance to re-heal.
Yeah, those can be a little strong.
Yeah.
Yeah, absolutely. We have had a couple questions pop up that I'm going to go ahead and jump into and ask you about. You mentioned just a second lasers. This kind of goes along with it, I guess, red light therapy. Somebody said, what are your thoughts on red light therapy?
Red light therapy can be very helpful. We use it a lot sometimes if even like post laser treatment. So if you had a laser and you just had a lot of redness afterwards or a lot of bruising, it can help move that along very quickly. It's a pretty painless procedure and it's pretty quick as well. So we do have patients come in and they sit with a red light for a couple seconds and that can help reduce redness. So I'm a fan of red light therapy.
All right, so it's really quick then. Some other ones we have on here, let's see. It says, do some conditions truly go away with OTC treatments, over-the-counter treatments? Yeah.
Do some conditions go away with over-the-counter treatments? It's a pretty broad question, but I will say yes, but with the caveat that usually those would be mild conditions. So for example, acne. If you have mild acne, you're not getting too much breakouts, you're getting a couple spots here or there, you can buy over-the-counter acne products to treat them and you might be fine. But if you're getting to the point where you've been using over-the-counter and you're still not getting it under control, I think that is the point where you should see a dermatologist.
Okay. All right. And then another question, what would you recommend for the best procedure for sagging skin on the neck? I know this one gets neglected a lot. People think about their face, yes. And then they think about the neck. So the neck ages too. So what would you suggest?
I'm guilty of it myself. I have a dermatologist friend of mine, and we always joke, "Don't neglect the neck," because it's easy. No shame in it. It's easy to wash your face. You put on your topicals, and you kind of stop here. So in general, as you're using your actives, whether it's a retinoid or vitamin C, etc., don't neglect the neck and let it, go onto that neck area. In terms of sagging skin on the neck, there are actually a multitude of treatments. I don't know if I have a favorite, but I'll just give you a few examples. You can do something called microneedling on the neck that can help with what we call skin laxity, which is the fancy way of saying sagging skin. You can also do treatments that have ultrasound technology, such as Ulthera or Soft Wave. There's something called Thermage you can do on the neck. So there's a multitude of devices that can be helpful for that.
Okay. And then you just mentioned microneedling. Can you explain a little bit about what microneedling is? I've heard so many different people's ideas of what it is. I'd like you to kind of clarify that a little bit for us.
Yeah, so there are different types of microneedling, but the core basis is essentially you're making these tiny micro holes or channels in the skin to encourage and induce collagen rebuilding. And so the surrounding skin therefore sort of fills it in a way that you now have new, tighter, and hopefully less saggy skin where those holes are. Those holes, for the most part, can vary in size depending on what the problem is that we're treating. So we use microneedling, for example, for acne scars. Sometimes we use it for skin textures. You hear about people sometimes complain about pore size, so that might be a reason to do microneedling.
You hear that a lot,
Yeah, occasionally for just general skin sagging. So the size of the needles depends on what we're treating. But in general, we're making these really, really small microscopic holes in the skin to induce collagen. And microneedling can actually be paired with other things. So for example, PRP, which is platelet-rich plasma, and I think that's becoming increasingly popular now, can be combined with microneedling. So you would make holes with the microneedling, and then you might, for example, smear on PRP to further, rejuvenate the skin and boost collagen.
Okay, great. Thank you so much for that.
No problem.
Again, it's like you kind of have this idea in your head, but you're not quite sure exactly. So
yeah.
Another thing that we hear a lot from our customers and they ask us about is hyperpigmentation. And I know that, some people think that you can just buy any kind of product and it's supposed to help. Some people say the only thing that's going to help it is if you get some sort of procedure done like lasers or something like that. Can you kind of talk a little bit about that, about number one, what is hyperpigmentation? And then two, what kind of procedures you can do to help that, if there are ingredients in skincare that you can use to kind of help combat that?
Yeah, so hyperpigmentation is a very broad category, but in general just refers to skin that is darker than your surrounding skin. Sometimes people will commonly say dark spots on the skin,
Mm-hmm.
and it could be different things, but I find for the most part when people are referring to hyperpigmentation, they're talking about post-inflammatory hyperpigmentation, which means that either you had acne or you had some sort of injury or just something happened to your skin, it was inflamed. And then later on when it healed, it left a little bit of extra melanin, some dark spots on the skin. So that's what hyperpigmentation, for the most part, when people are referring to, that's what it is.
Okay.
It is very, very common, as you can imagine. I deal with it on my own skin. I think I was joking with you earlier that if you breathe on me too hard, I'll hyperpigment. so, so
it's like the older you get, the quicker, yeah,
exactly.
It's easier to come on.
So it's a personal passion of mine because I dealt with it even before I became a dermatologist, and I know it can be frustrating for other people. You can use lasers, and there are different lasers that we treat with for hyperpigmentation, and there are topicals that are effective as well. One of the most common that people are familiar with is hydroquinone, which I know has a lot of controversy because of sometimes it's abused in certain contexts, but there is a role for it in our dermatology field and practice, and if it's prescribed correctly, then it can be extremely helpful. Other topicals, such as retinoids, can be helpful for hyperpigmentation. Vitamin C can be helpful, and then there are things like kojic acid can be helpful. There's something called cysteamine, which can be helpful. So there's actually a pretty wide gamut of things that you can use that address different reasons why you might hyperpigment. And often, most likely, if you were to come see me or another dermatologist, they're going to use different products in combination to try and get you the best outcome.
Okay, good. Okay. Yeah, that's such a, like you were talking about hydroquinone, all the kind of stuff around it. Some people said it's the only thing that you can use that works without some cosmetic procedure, all that kind of stuff. So yeah. Thank you for that.
No problem. Yeah, there's a lot of alternatives out there. So if you're someone who does not want to use hydroquinone, there are other things that we can use.
Right. Okay. Great. A couple more questions popped up. Let's see. We kind of talked about the neck a little bit, but this person is talking about, Mimi's asking how to treat neck lines and why do some people get it more than others? So what's the best way to treat it? And why do some people necessarily start aging so much quicker in their neck area than somebody else might?
Yeah, there are different reasons. Some people will call it like tech neck, which is essentially, our generation when we're texting a lot, we're kind of putting a lot of pressure on the neck.
Everyone's heads down.
That's my impression. Over time can create, or rather probably deepen is a better word, because everyone has necklines to some extent, but some people can have deeper necklines because of how they position their neck. That being said, that's not always the case. Some people just almost genetically just tend to have deeper necklines, or I should say more prominent necklines that bothers them. There are different ways that we can treat it. One of them is with laser, which is a very multifaceted word, but we can use laser. We actually also can use filler. Specifically, we put like little micro droplets of filler across the neckline, which helps induce collagen and then sort of lift up where that line is. And you can do that multiple times. And another one, which we talked about before, microneedling is also useful for that too. So
on the neck as well. You can do that.
Yeah. So there's a couple of different ways you can treat the necklines, and it'll vary depending on how deep your lines are, and then of course your budget and what you want to use for that. But yeah, there's a couple of different approaches for treating necklines.
Got it. Okay. This one came up, and I think it's a very, very important question, and it's something that we get asked a lot too at dermatology. Is Botox and fillers, are they safe to use when you're pregnant?
So I would say no. And in general, I think a lot of cosmetic dermatologists would avoid it while you're pregnant. In fact, we often joke sometimes I have patients who they're planning on getting pregnant, and so they want to get their last Botox and filler in before they start trying. And, you know, a lot of that is with pregnancy, sometimes we just don't have a lot of data on how things are affecting the fetus. And so it's just better to be conservative. And if something hasn't been tested on pregnant women, in general, we would just recommend avoiding it. Mm-hmm. At least just for those 9 months. And then if you're breastfeeding, obviously, yeah.
Exactly. When you're in it, it feels like forever, but honestly, it's over like that. So exactly. Really quick, for those of us, or for those of you, I should say, who have joined us before we started, we are with Dr. Nkem, and we are talking about skincare. She focuses a lot on cosmetic procedures and lasers. So that's kind of what we're focusing on today, but we're talking all things skin. So if you have any questions, please feel free to drop them in the comments, and we are going to get to as many of them as possible. So on to our next one. With that being said, jowls, this kind of little section right here that you start to get that sags down a little bit. Mm-hmm. What is the best thing that you can do for jowls? Or is there anything that you can do for them?
Yeah, it's a common, very, very common complaint. So that filler would be helpful for as well. Not necessarily always directly into the gel, but sometimes you can place filler sort of behind here to kind of pull this part a little bit back. There are other things that you can do, such as threads might be useful, which is something that it's a suture based product that goes underneath the skin and then kind of pulls your skin back this way. Oh, wow. Mm-hmm, yeah. There's also ultrasound based devices. I think I mentioned that before. That can be helpful too, because those can tighten the skin, because jowls are essentially excess skin. It's skin laxity, just in a very, very, I guess, obvious area that subsequently bothers people. But all the devices that we use for skin laxity can be helpful for that area too.
Got it. So like you were talking earlier about fillers, you know, I think most people think of fillers, they think, you know, around your mouth or this kind of area that starts to get hollow. Is it when you start to lose that fullness here? Is that what kind of drops the skin here? Is that what causes
and
those?
then also, so that contributes to it. And also, as we get older, our bones start to resorb too. So your bones are not as full as they are when you're younger, and subsequently skin can start to droop too. Yeah.
Wow. Okay. Oh, this is a good one. Because when you think about skincare, obviously everyone thinks about your face. You know, we even talked about how some people neglect the neck. But this one, Marissa is asking, what's the best way to treat aging hands?
Ooh, that is a great question. So if it's a volume issue, I love to, here we go again, filler. I love filler.
So you can put filler in your hands too?
You can, yes. And actually there's a one particular filler that is sort of a calcium-based product, and we dilute it multiple times so that it's, you know, very, very dilute. And you can just make a little entry in the hands and then add a little bit of volume to the hands. It actually looks really, really great. It's one of those surprising things that you don't really think of when you're not in this field, but it leads to a really nice result. So I like hands. If volume is I like filler for hands if volume is the issue. Sometimes for other people though, it's not necessarily volume. It can be like discoloration, and in that case something like a laser would be helpful. Like a lot of old women will have, you know, certain brown spots, sunspots, and we can use a laser that specifically targets pigment to make sure those get lighter.
Okay, very, very helpful. This is a good one. We've been talking about fillers and Botox, but how long do they last? Let's say someone decides they've never done it before. They want to get this done. How long can they expect the results to last for?
Yeah, so Botox will last on average about 3 months. Some people might get a little bit more mileage out of it, just kind of depending on how their body metabolizes it. But we usually tell patients to expect about 3 months. Fillers can last up to a year, actually. We do have some patients who, yes, they can. And then we do have some patients, though, that, you know, as you go further along and it starts to, you know, fade a little bit, they might want a touch up, and it might be that you don't need as much as you did before. So some people might come in more than once a year, but in general, they can push up to a year, depending on which exact filler that you're using.
Okay. And then when someone was to do that, someone who, let's say, is a newbie, like I was just talking about, how much is too much when it comes to Botox and fillers? I mean, you see like we were talking about, some people have this, you know, perception in their mind about if you get it, you're going to look like that fake duck face kind of person walking around. But, you know, you had also said too that it's very possible just to kind of keep and maintain the look that you already have. You don't have to look fake like that. So kind of where's that balance? Where's that line of what's acceptable and natural, and then what is like going to take it past that into looking fake?
Yeah, I think the answer to that question is going to vary for each person. And the most important thing, in my opinion, is the consultation with your dermatologist, because that's where you're going to talk about, you know, what bothers you, what your goals are, and you can get a sense of what you can realistically expect with Botox and with filler. So for example, if you have really, really, really deep creases, you know, going to a knowledgeable injector might say like, hey, these aren't going to go away entirely, but they will soften. And if you keep up with your Botox, for example, then over time, you'll notice that those lines are getting better. So too much to me is a relative term, but I think that between your injector and the patient, you should be able to come up with a nice, you know, middle ground depending on what your goals are. And, you know, sometimes, honestly, as a dermatologist, sometimes people have goals that are just not necessarily accomplishable with what we have. And the beauty of seeing someone who is board certified is they can answer honestly, and they can, you know, see if it's a good fit. Because if somebody wants something you can't give them, then you should know early on so that you're not unhappy afterwards.
Right. And I think that is kind of one of those misconceptions again, too. Someone thinks that if you go to get Botox or fillers, that it's going to fix everything. And you're going to walk out without a wrinkle, without a crease. You're going to look 20 years younger. Like, everything's going to go away. And that's not realistic either. So,
yeah, exactly.
Okay, this was a good one. LED masks. They're kind of a huge trendy thing right now. You see all the ones, you know, the different kinds they have, and you know, the different colored lights and all that kind of stuff. In your opinion, do those work? Are they helpful? Are they useful?
So I think some people find them helpful. I'm not against them. I'm not opposed to them. I personally think that we need a little bit more data, like from a scientific perspective, before we can say, you know, that this is a highly effective thing that we would recommend. So I don't personally recommend them, but if I have a patient who uses them and likes them, I'm not against it, and I say that, okay, that's fine, you can continue. In addition to X, Y, Z.
But it's
exactly, it's not going to hurt. It might help, but we're going to do X, Y, Z on top of it.
Okay, perfect. For someone who does want to get started with Botox, is there an age that you recommend someone get started? I know a lot of people think that it's, you know, once you have it, that's when you want to start to kind of soften everything. Some people say it's going to be preventative, so start when you're really young. What would you say is a good age or a good time to start those kind of procedures?
Yeah, you know, it's funny. You think that, you know, there's a certain age you hit and then the wrinkles start to come, but you'd be surprised. There are sometimes you'll meet like a 24, 25-year-old who, for some reason, and sometimes it's genetic, they just have very, very expressive lines, and they see that, you know, in their parents, they look at their parents and they say, I don't want it to get even worse, and so like I want to start now and soften the lines, and that's perfectly fine. And other times you'll have, you know, 40, 50-year-olds who don't have any lines. So I don't think that there's like yeah, I know it's rare, but it does happen. It does happen. At least any lines with expression, I should say. But you know, it's I don't think there's a magic number. I think that if it's a point where it bothers you, then I think that it's okay. I personally wouldn't do it on a teenager, for example. But, you know, I think if you're an adult and it bothers you, then that's okay. There is a thought now of something called preventative, or some people refer to it as micro Botox, which means that Botox that's often usually diluted a little bit more. And so the intention is not to freeze completely, but just to kind of, you know, soften the muscles, if you will. And I do that sometimes too. So that can be a nice entryway for people who have never had Botox before and then just
feel nervous about it.
Exactly. Yeah. Just want to try it out and see what it's like before, you know, going full steam ahead, so to speak.
Right. And then obviously, you know, it is a procedure. It is something that you're putting into your face. Let's talk about the downsides. What would be the downsides of getting something like a filler or a Botox?
Yeah, so with filler, one of the biggest, or if I should say most common side effects is bruising. And, you know, bruising can occur anywhere. Anytime you get an injection to the skin, whether it's Botox or filler, bruising is a risk. And simply if you have an experienced injector, you're less likely to get as bad of a bruise, but it doesn't mean that it's not going to happen. We all have vessels all over our skin, so sometimes you're just going to hit a small vein and you might have a bruise for a couple of days. With filler, you can get inflammation. Sometimes you can get nodules under the skin or like lumps under the skin, but we do use a lot of fillers that are reversible, which means that we have an antidote, so to speak, that we can dissolve them if that were to happen.
So if you were to get one of those lumps in there, you'd be able to kind of break it down?
Yeah, so we use a lot of what's called hyaluronic acid-based fillers, and there is a product that is called hyaluronidase, which means hyaluronidase breaks down hyaluronic acid. So if you use one of those hyaluronic acid-based fillers, and let's say you were to get like a little bit of a lump underneath the skin, we could dissolve it. So that's a issue that can be solved or resolved, I should say. The most concerning side effect, or I should say something that could go wrong, which is why I always recommend seeing a very experienced and certified injector, is because you get filler into a vessel, such as an artery, and potentially get necrosis. I don't want to scare your audience, but I think that sometimes now with social media, you see things being injected, and like people do it like the nose and areas that are actually really high risk, and they make it look very easy. But we are injecting something into the skin, and subsequently, you want to go to someone who went to school and was trained and took an exam, so that they are very familiar with the anatomy and therefore know which areas are high risk and to avoid, so that you don't have a negative result.
Right. Yeah, you want to know the pros and the cons too before you make a decision like that, because it is, like you said, you're injecting something in your skin, so definitely know what what the possibilities are.
Yeah.
Okay, so just a couple more. Microdermabrasion. Some people hear that too, and they think it's just like a scrub that you can buy, which it is. Some people say they only get, microdermabrasion done at like an esthetician or at their, at a dermatologist office. Kind of what is that exactly? And are there different levels to it or different types?
Yeah, I think the word is a little easily used, or I don't want to say misused, but it's thrown around a lot. Like you'll buy something over the counter that says like, this is a microdermabrasion cream or something like that. And usually that just means it's something that exfoliates the skin, but you can have a professional microdermabrasion done, which is usually done with a device that is clearing out the skin and removing, impurities or oil or clogged pores, etc. And that would be done in an office, specifically by a professional, if that's something you wanted to get done. They do have some at-home devices, and it's not that those don't work. It's usually just they're not as sophisticated as the devices that you'd get in an office. So you can think of it as like a lighter version of what you might get if you were to make an appointment.
Right. Okay. Again, for those, I think a lot of people listening, a lot of people tune into because they wanted more information about these kind of procedures, maybe because they didn't know or they're thinking about it and it's something that they're considering. For those people who, let's say, they're just not ready for it. They don't want procedures done yet. They're interested in preventative skincare. What type of ingredients or what kind of skincare products would you recommend somebody like that to use to kind of prevent the signs of aging?
Yeah. So the number one most important skincare product is sunscreen. And
yes.
Sunscreen. And regardless of your skin color, because I know there's some myths associated with that too, but everybody should wear sunscreen. In addition to the benefits of, preventing skin cancers and other issues, it also helps prevent aging, or I should say slow down aging. The sun rays are one of the things that can exfoliate. And the best example is actually, there's this, I think it's New England Journal of Medicine. There's this photo of a truck driver who one side of his face had been, facing the window for many years.
Blows me away.
Night and day. And so literally anytime anyone says, why should I wear sunscreen? I'm like, look at this photo.
Show them that picture.
It's just very, very, very important. And, the sunscreens have come a long way recently. So everyone, I think, can find a sunscreen that works for them, whether it's tinted one or not tinted one. So sunscreen is the most important one. Sunscreen,
Yes.
sunscreen, sunscreen. In addition to sunscreen, other things that I like are retinoids. We talked about retinoids. So retinoids can help cause skin cell turnover on the skin, and it's good for acne, and it's also good for anti-aging, in addition to hyperpigmentation. So retinoids are a nice thing to add. And then there are other things. I'll just say one other one that is a favorite of mine is topical vitamin C. And though that item pairs very well with sunscreen, it helps prevent, external environmental damage, the antioxidant that just works against free radicals. So I often will recommend to patients to have a topical vitamin C and then a sunscreen on top in the morning.
Yeah, it's what I do every day. I love it. It literally has changed my skin. I use our vitamin C and ferulic acid serum that we have. And then I go back and forth. Yeah. And then I go back and forth between my favorite two sunscreens are our broad spectrum. It goes on clear. So it doesn't matter what your skin tone is. It literally does go on clear, even though it pumps out white. And then our universal tint. If I don't want to wear any makeup that day, I just kind of want just a sheer, little bit of coverage. Our universal tint just kind of gives that perfect glow. And again, that's something that's universal for every skin type as well. So it doesn't matter if you're super fair or on the darker side, it really does blend in seamlessly as well. But yeah, those two things I use every morning, and I really do. It has changed my skin.
Yay.
I love it a lot.
I love it.
So, okay, and then retinoids too. We have a retinol that's amazing. I use that at night. It is a strong one though. So if you're going to use it, I do recommend starting out slow and kind of let your skin adjust and go from there. But
retinols in general, I always tell people to start either every other day or just 2 or 3 times a week, and then build your way up from there, with the goal of doing it every night. But go as tolerated, baby steps with the retinoid.
Yeah, slow is good when you're trying to build up that tolerance to it.
Yeah.
Dr. Nkem, thank you so much for joining us today. It was very informative. I know I learned a lot that I didn't know before, so I'm sure everyone tuning into did as well. I think a lot of people think that so much, we as dermatology, the company, focus all on skincare, but we kind of want to talk about all things skin and what the best way to take care of our skin is. And sometimes that includes, some cosmetic procedures or lasers or things like that as well. So we definitely want to talk about that too. So thank you for sharing your wisdom with us today. And then for everyone watching, if we didn't get to your question, I'm so sorry. We got to as many as we could, but we will address all of your questions. So if you put something in the comments that we didn't touch on at all during this episode, we will address them. We will get back to you with answers. And if you think of questions later on, maybe we get off of this and in a half an hour or so, you think, oh my gosh, I should have asked her this. Again, you can come back and ask us, and we will definitely get you the answers that you're looking for. So thank you everyone for tuning in. Dr. Nkem, it was so much fun. Thank you for joining us. And
thank you for having me.
Of course, it was our pleasure. I hope to see you soon. And everybody, thank you again for joining, and we'll see you next month.
Bye, everybody. Thank you.